We're trying something a little new today, and that's a remote video interview. My guest today is John Brownstein, who is the new Chief Innovation Officer at Boston Children's Hospital. John, thanks for joining me today.
Great to be here.
And you are replacing kind of a legend, the first Chief Innovation Officer at Boston Children's, namely Naomi Freed, who left to join a startup a few months ago. You've been on the job about a month replacing her, but as you had mentioned to me before we started recording, that you've been sort of transitioning into this role for several months.
Yes, that's correct. And so yeah, absolutely. So I've actually been at Boston Children's for about 11 years now. And I'm a researcher by background. So I got my PhD in the area of epidemiology, and I've been thinking about how the intersection of technology and health for quite some time. So I run a research group that does work in digital health, actually.
Right. That was well, you were running the computational epidemiology group that cuts across several Harvard and other Boston area institutions.
Exactly.
So now you've moved into this role at Boston Children's. Is it different, being at a pediatric hospital versus what you had been doing before?
Well, I've been at a pediatric hospital this whole time, so my primary appointment is at Boston Children's. Cross appointment in Harvard, in the medical school, and for biomedical informatics. But I've been actually running a group, at Boston Children's for this whole time, and so I've gotten pretty acquainted with the processes and the various stakeholders when it comes to innovation at the hospital. There's a number of different groups that touch innovation, that are supportive of, that want to see innovation grow at the hospital. So I myself have interacted with many of those groups, and are in a fortunate position to be able to lead the innovation program now.
Okay. Tell me about some of the most interesting projects you're working on, or some of the projects maybe that you inherited, and some of the things that you think are working, being used well in the institution.
Right. So I mean, we are, what we've done a great job with the innovation program is really thinking about how to tease out, small scale innovations at the care interface. So opportunities where nurses or doctors have found an ability to add a device or a tweak to a procedure, or maybe even a mobile app. So there's a whole range of projects that have either been funded by the program or have been supported through what's called the FIT team, the Fast Track Innovation Group. Basically done an incredible job of building mobile and other technological applications that sort of are designed to improve workflow and improve clinical care. So there are a number of different projects that are in place around potentially doing a better job of extracting data from the EMR and providing better data to the clinician, or they potentially are ways of improving the workflow as a patient is triaged, brought through the process of, say, surgical care. So we have a whole sort of inventory of efforts that exist. And my goal as coming into the program has really been to think through how do we sort of take some of these early stage efforts that exist either funded by the program or that exist across the institution, and how to grow them to the next level. So working with our tech transfer office and our legal department and many aspects of the hospital to do a better job of showing how our innovations from the inside can exist outside the walls. Because really what we're
so you're talking about commercialization at that point.
Partly, yeah. So what we see is, of course, you can begin to expand the hospital in brick and mortar ways, and that's definitely happening. But one of the great ways that we can begin to scale is, of course, taking our know-how and knowledge and potentially data and learning from data and embedding it in software and devices, places where that know-how can then exist. So if you, for instance, have an algorithm that can improve management in the ICU, well, if you embed that into an existing device or a ventilator, for instance, then you can see that potentially that know-how be disseminated much more broadly. Or if you can develop a tool that exists on the EMR you can then begin to see that app, propagate in other settings. And that's really what we're very excited about, is thinking about how the growth of the digital Boston Children's in addition to its sort of physical growth.
And this would be for staff and patients and their families alike, I take it.
Right, exactly. So obviously we're trying to improve the workflow of clinicians, but we're also trying to improve the ways in which patients can interact with the hospital, whether it's through virtual visits or through more consistent care via remote monitoring or care coordination. So a big part of what we're doing is thinking about what we have in the know-how of the hospital, and taking that and bringing that to software, but also thinking about partnering with, I would say, companies that are highly resourced to think about some of these important problems.
Now, often when people talk about innovation, they might limit their thinking to mobile apps, and it sounds like you're going beyond that. You mentioned medical device integration at one point.
Right, exactly. Of course, mobile apps is one big area of work, and our teams are very well versed in that. But really, it's significantly beyond that. I mean, it's taking our know-how and in whatever, or how we can improve the processes of care, in whatever form that might look.
Okay. What's some of the more interesting things what are some of the more interesting things you're working on right now?
Yeah, well, right now what we're doing is, we're in the middle of a big inventory of all the number of projects that are going on across the hospital, and there's quite a few. There's a number that touch, the ability to, so for instance, epilepsy tracking, and how we use wearables to basically understand whether a seizure might be imminent. There's efforts that are, so those are efforts that are really about care outside the home. There are efforts that exist that are much more about improving the workflow at the hospital. So we have a project called Cameo, which is essentially attempting to
what was the name again?
Cameo. And basically a project attempting to classify the acuity of a patient using multiple data inputs from the EMR, and that's an effort that's led more internally at the hospital.
Interoperability, essentially.
Yeah, and in fact, even my team at the hospital is working on projects. So, for instance, we're about to launch a project called Crowd Clinical that is all about understanding what patients are saying online about clinical cases, clinical care, and organizing that data into sentiment and across multiple dimensions to basically come up with a new metric for care quality. So that's another tool that's actually coming out of my research group.
Yeah. No, I actually last week or last month, I would say, wrote something about a paper that you had published in the Journal of Medical Internet Research about mining Twitter to look for potential sleep disorders.
Right.
That's some of that kind of work. Is something I take it that interests and excites you, being able to mine social media with essentially natural language processing?
Exactly. So that's more in the sweet spot of my research group, where what we term the digital phenotype, this idea that data that is generated in the course of your daily lives, either by interacting with the web or your wearables, that data collectively can paint a very unique picture of your health status and your health behaviors and chronic infectious disease. And so, we're using these digital breadcrumbs to understand the health of the population scale, but eventually to inform clinical care as well.
Do you find that it may be necessary to have some really cool digital tools to get, say, young people with chronic diseases to care more about their health and want to take care of themselves a little bit better?
Well, yeah, I think that our perspective on this is pretty simple. Like, you can either try to create new technologies and hope people engage, or what we say is we'll go to where the patients already are. So, the patient voice already exists in many of these platforms. So
social media, you're talking about, essentially.
Yeah, whether it's social media or even devices like Fitbit and others.
Yeah.
And of course, leveraging and really beginning to understand ResearchKit and where where the idea of the mobile-based platform for collecting health-related data can really help drive research and innovation.
Yeah, yeah. Tell me a little bit about what you're doing with ResearchKit. That's something that seems kind of exciting to me. Obviously, it's still in the test phase. It's brand new. Apple's trying to figure it out, as are its many partners and users.
Yeah. So we don't have anything yet to announce, but we're actively working to build out a couple examples in the space. First, we're taking our mobile development team, and making sure that we create a framework for developing off of ResearchKit, so that we make tools easily available to the community, to the Boston Children's community, and hopefully even beyond. So that's really what we're
You're talking about researchers and clinicians.
Yes, exactly.
Okay.
Leverage. So we're going to be working in communication with Apple to figure out how to best provide those tools. But that's really now in just early development stages. So
okay.
We haven't announced yet, but hopefully very soon.
Okay. Now, Apple's sort of, from the perspective of the media, Apple's a tough nut to crack. They don't often say a lot of things publicly, but how do you find them to work with, from the perspective of an academic hospital?
Yeah, I mean, I think they've been highly engaged, and you can see some really
and considering that they've made mostly consumer-centric products to this point.
Well, it's very exciting that they're in this space. They've done some great collaborations, even locally, at MGH is one, but they've had several others.
Right.
And this is an area that they're really, pushing in. So it's exciting. We're obviously very excited that this represents one of their core initiatives at this moment. Okay.
So, anything else that you would like to share with the MedCity News audience and our the wider viewers who might follow us
we're very
on YouTube about innovation in healthcare in general?
Yeah, I mean, I think that we're very lucky at Boston Children's, because an innovation program existed, and there was somebody in this role before, and it created a really amazing infrastructure and the ability to have a core team that is doing development and enabling clinicians, researchers to have an arm to sort of see some of those maybe wild ideas come to life. I think what we're really excited about now is to think about the next step, how we start to work with outside organizations, incubators, VCs, vendors, companies that are really interested, especially getting involved in the pediatric domain, which sometimes gets a backseat to the broader areas of care. So I think that's really what our big mission is going to be over the coming year.
Okay, and you have a lot of that in Boston already to choose
from.
And even within the Harvard organization.
Yeah, absolutely. So we're excited to work with our counterparts across Harvard, but in Boston area and beyond.
Okay, well, I've been speaking with John Brownstein, who's the new Chief Innovation Officer at Boston Children's Hospital. Although he's definitely not new in this field, I appreciate you taking the time to explain some of the work that you've been doing.
Great, thank you so much for your time.
Thank you.